everyone, welcome to our YouTube channel for nurses preparation. I am Neeraj Kumar Kaithal. Today we are presenting few important question and answers from the subject medical surgical nursing from the topic cardiovascular system. All the questions discussed in the video all are very important. So everyone, let's begin our today's video. Our first question is, which chamber of heart receives oxygenated blood? As you all know, heart is having four chambers: right atrium, left atrium, right ventricle, left ventricle. Which chamber of heart is receiving oxygenated blood or oxygen rich blood? The option A for this question is left auricle, option B right auricle. You can call atrium as auricle also. So everyone, this question's answer is option A, left auricle. Heart's left auricle or left atrium receives oxygenated or oxygen-rich blood from the lungs by the pulmonary vein. In our body, pulmonary veins are the only veins that carry oxygenated blood, and pulmonary artery is the only artery that carries deoxygenated blood. Our next question is question number 2. Tricuspid valve is located between option A, between right atrium and right ventricle, option B, left atrium and left ventricle, option C, left ventricle and left ventricle and aorta, option D is right ventricle and pulmonary artery. Tricuspid valve is found between. So everyone, this question's answer is option A. The tricuspid valve found between the right atrium and right ventricle. Tricuspid valve found between right atrium of heart and right ventricular of the heart. Tricuspid valve also known as right AV valve or right atrioventricular valve because it is found in between right atrium and right ventricle. Now let's discuss about the other type of valves. Second is bicuspid valve. The bicuspid valve is found between the left atrium and left ventricle. This is the bicuspid valve. This valve is also known as mitral valve or left atrioventricular valve. Left atrioventricular valve because it is found in between left atrium and left ventricle. The third type of valve is known as aortic valve. Aortic valve, you can see in the diagram, blue colored structure, it is known as the aortic valve. It is found between aorta and left ventricle of heart. The last type of valve is pulmonary valve. You can see here with the blue color design, this is the pulmonary valve found between right ventricle and pulmonary artery. Our third question is, which structure of heart known as natural pacemaker? Option A, AV node, option B, SA node. Option B is the right answer. Natural pacemaker of heart is known as SA node. SA node full form is sinoatrial node. Location of SA node: wall of right atrium near entrance of superior vena cava. In the right atrium of heart, on the wall of right atrium near the opening of superior vena cava, SA node is found. It is a group of specialized cells that produces impulses that causes heart to contract or produce heartbeat or heart rate. It produces impulses approximately 100 per minute. Question number 4 is, in electrocardiogram, ECG, QRS complex occurs due to option A, due to atrial depolarization, option B, ventricular depolarization. Here the depolarization word's meaning is contraction. Depolarization of heart means contraction of heart. Atrial depolarization means contraction of atria. Ventricular depolarization, ventricles contraction. You can see the ECG diagram in the picture. QRS, this is the complex. This complex is formed due to atrial depolarization or ventricular depolarization. It is a very important question. Answer fast. Everyone, option B is the correct choice. QRS complex is formed due to the ventricular depolarization. P wave of ECG is formed due to the atrial depolarization. Atrial depolarization, once again I am saying atrial contraction. Guys, let's revise few important points regarding ECG. ECG's full form is electrocardiogram and the procedure is known as electrocardiography. By this, heart's electrical activity is recorded on paper. P wave is the first wave and it is positive wave due to depolarization of atria. P wave duration 0.1 second. Longer QRS complex seen in two conditions. First is premature ventricular beats and the second one is ventricular arrhythmias. Here's the next question, everyone. Difference between systolic and diastolic pressure known as option A pulse pressure, option B pulse deficit. The right answer is option A pulse pressure. Difference between systolic pressure and diastolic pressure known as pulse pressure. Option A is correct. Let's understand this condition with example. In a person, normal blood pressure is 120 by 80 mm of Hg. We want to calculate what is the pulse pressure in this condition. This is the upper BP known as systolic pressure or systolic blood pressure, and this lower value is known as diastolic pressure or diastolic BP. Diastolic BP is subtracted from the systolic pressure and the value that comes known as pulse pressure. 120 minus 80 equals 40 mm of Hg. So normal pulse pressure is 40 mm of Hg. Let's have a short and quick revision about what is pulse deficit and cardiac output condition. Pulse deficit is a condition difference between the heart rate and palpable pulse. To calculate the pulse deficit condition, we need two health personnel. One is taking pulse rate with the help of stethoscope from the apical pulse site, and the second person at the same time count the pulse from the palpable part. We can take it as from radial site. Now, if the person is having atrial fibrillation like conditions, this time the pulse deficit is seen. In the normal situations, we don't have any difference between the palpable pulse and the actual heart rate. Now let's talk about the cardiac output condition. Amount of blood pumped out from the left or right ventricle of heart per minute is known as cardiac output. We can calculate this actual amount of cardiac output with this formula: stroke volume multiplied by heart rate equals cardiac output. Our normal stroke volume is 70 ml and the heart rate is 72 beats per minute, and the approximately value of this multiplication is 4900. We can say in a normal healthy adult the average cardiac output amount is 5000 ml. Question number 6. P wave commonly absent in which disease condition? Option A atrial fibrillation, option B atrial flutter, option C ventricular tachycardia, option D all of the above. It is very important question. Please write down your answer in comment sections below. The right answer is option C. In ventricular tachycardia condition, P wave of ECG is commonly absent. Question number 7 is, what is the antidote of digoxin drug? Digoxin is a very important drug. What is its antidote? Right answer is digoxin. It is also known as digoxin immune fab. Digoxin immune fab or digoxin used as an antidote for digoxin poisoning. What are the uses of digoxin? It is used in the condition like atrial fibrillation, atrial flutter, and in heart failure. Question number 8 is first drug of choice in myocardial infarction condition. The options are option A heparin, option B morphine sulfate, option C ecosprin, option D none of the above. Myocardial infarction is a very important condition. Most frequently asked questions come from this topic. If you know the answer, please write the answers in comment section below. The right answer is option B. Morphine sulfate is a drug of choice in case of myocardial infarction. Question number 9. What is normal sinus rhythm? Options are A. 60 to 100 beats per minute. Option B. 300 to 350 beats per minute. Option C. 120 to 160 beats per minute. Option D. 200 to 250 beats per minute. It is a little tricky question. Be careful while choosing the answer. The right answer is option A. 60 to 100 beats per minute. Actually, the examiner want to know what is the normal rhythm of heart. What is the normal heart rate? This was the question, and the right answer option A. 60 to 100 beats per minute. What is most sensitive cardiac marker? Option A. Creatinine kinase. Option B. troponin. The right answer is option B. Troponin is the most sensitive and most specific cardiac marker. Question number 12. U wave in ECG is seen in which condition? Option A. Hypokalemia. Option B. Hyperkalemia. The right answer is option A. Hypokalemia. In hypokalemia condition, you will see U wave in person or patient's ECG. 13. What is thrombocytopenia? Option A. Decreased platelet count. Option B. Increased platelet count. The right answer is option A. Thrombocytopenia means decreased platelet count. Next question everyone. Question number 14. What is the full form of AED? Option A. Advanced emergency defibrillator. Option B. Automated external defibrillator. The right answer is AED stands for Automated External Defibrillator. Option B is the right answer. Automated External Defibrillator is the full form of AED. Now let's discuss about what is AED, Automated External Defibrillator. In treatment of cardiac arrest, lightweight battery operated portable device that checks heart rhythm and sends a shock to the heart to restore normal rhythm. Next question number 15 friend. Hemophilia A is caused by the lack of clotting factor number. Option A clotting factor number 9, option B clotting factor number 8. Hemophilia is a bleeding disorder. It is also known as royal disease. Hemophilia A is due to clotting factor number 8's deficiency. Option B is the correct choice. Hemophilia B is caused by the deficiency of clotting factor number 9. Next question. Which coagulation disorder is an autosomal dominant disease? Option A. Hemophilia A. Option B. Von Willebrand disease. The right answer is option B. Von Willebrand disease is a coagulation disorder. It is also an autosomal dominant disease. Next question, friends. What is the normal capillary refill time? Option A 1 to 6 seconds. Option B 1 to 3 seconds. Option B is the correct choice. 1 to 3 seconds is the normal capillary refill time. Next question, question number 18. You are monitoring an infant with congenital heart disease for the signs of heart failure. Choose from the following options that will be the early sign of heart failure. The option A, pallor, option B, cough, option C, tachycardia, option D, none of the above. Simply you have to answer what is the early sign of heart failure condition in an infant with congenital heart disease. In this situation, the right answer is option C, tachycardia. The first sign in heart failure developed, that is tachycardia. Now let's talk about the early signs of heart failure. Tachycardia, increased heart rate; tachypnea, increased respiratory rate; profuse scalp sweating; fatigue; irritability; sudden weight gain, and respiratory distress. All these are the early signs of heart failure. Now let's discuss about the other two options that are present in the question, pallor and cough. Both may be present in heart failure, but these are not the early sign of heart failure. Question friends, aspirin drug is administered to the client who is experiencing myocardial infarction. Option A, aspirin is having antithrombotic action, so it is administered. Option B, aspirin is having antiplatelet action, so it is administered in the client who is experiencing myocardial infarction. Very important question. The right answer is option A. Aspirin drug is administered in a client who is experiencing myocardial infarction because of its antithrombotic action, not just because of antiplatelet action. Now let's talk about the antithrombotic agent. Antithrombotic agent are the drugs that reduce the formation of blood clots. Antithrombotic drugs are the agent or drugs that reduces the formation of blood clots. Antiplatelet agents stop platelets from sticking together and forming blood clots. Antiplatelet agents stop platelets from sticking together and forming blood clots. Platelets stick together at injury site to prevent bleeding. This is the major difference between the antithrombotic agent and antiplatelet agents. Next question, friends. Heart sounds are result of option A, due to the contraction of cardiac muscles; option B, due to the closure of heart valves. Very easy and important question. The right answer is heart sounds are produced due to closure of heart valves. Heart valves closure causes heart sound. Last question of this video. What is the normal heart rate or pulse rate? In a healthy adult, normal heart rate or pulse rate is 72 beats per minute. So everyone, this is our today's video. Important 20 questions from cardiovascular system. How was the video? Please write your feedback in comment section, and if you find this video is helpful, then please click upon the like button, share this video with your friends, and if you want such more videos regularly, then please click upon the subscribe button. Subscribe for Nurses Preparation YouTube channel and support us. Thanks for watching. All the best.